Greetings and welcome, everybody. Espen here. Welcome to Dr. ETV. Today, I am joined by Dr. Gillett, medical doctor, who enjoys providing holistic, individualized care for his patients. His practice includes preventative medicine, aesthetics, sports medicine, hormone optimization, and many other integrative medicine pathways, which we'll discuss today as to how to use lifestyle and many other amazing tools to really optimize the performance of the human frame. So this is like precision medicine, including genomics, which I'm so excited to have that conversation. Dr. Gillett believes that each human is a unique creation that requires attention to their body, mind, and soul to achieve optimal health. He enjoys caring for others and using shared decision-making and evidence-based patient-centered approach. And this is really important. I was sharing with Carl just before we jumped on how this is so needed in the world right now, to have primary healthcare physicians with this level of, with this type of philosophy. So I'm so excited to get into this. Dr. Gillett is also active in obesity medicine organizations and firmly believe that food is indeed medicine. So we're going to have that conversation today. And exercise is medicine too. Dr. Carl Gillett describes the 6 pillars of health, which is exercise, diet, sleep, stress, sunlight, and spirit. I love that. These are some more powerful, very, very powerful and more powerful than medication, supplementation, et cetera, et cetera, et cetera. So let's dive deep into this conversation. I want to start by saying thank you so much for being here. How are you, buddy?
I'm doing well. Thank you. It's my pleasure. It is much colder here than it is where you are. We are in the midst of winter, but it's great to talk with you.
Indeed. And I know our Australian and international audiences will love this because they're really quite aligned with where we're at right now. So I just want to check in right now, starting with the high level question, more so than the granular stuff. What inspires you about doing what you're doing?
I feel like this would be my hobby. I know that this would be my hobby, even if it was not my profession. So in an interview that Mr. Beast from YouTube had, I think it was with Joe Rogan, he talked about why he was so successful. And part of it is just that is what he really likes to do. And he is very obsessed with it. And I'm very obsessed with health optimization. From a young age, I knew that I was going to be a medical doctor, and past that I was going to practice holistic medicine, taking care of people's body, mind, and soul. And in fact, I knew I wanted to do concierge, high quality medicine as well. So I've tailored my education thus, but at the end of the day, it's just something that I really like to do.
Love that answer. And, that's the bottom line. The secret to success is to find what you love and to do that, because you don't need any motivation when you have inspiration. So I think that's a super duper cool. So I know you have a real detailed approach to understanding, the physical aspects, the mental, the spiritual, and also the hormonal aspects of things. So I want to just quickly check in regards to the hormones. Can you tell us a little bit about your journey with hormones and what sparked your interest? Why that is so important?
Yeah, my interest in both hormone health and obesity medicine came up kind of hand in hand. You think about common pathologies. As a physician, you want to be very adept at treating common pathologies, and you want to be able to meet the needs of your patient. And in most developed countries, the need for treating hormone pathologies and also metabolic syndrome, of which obesity is part of, the demand is not able to meet the supply, and high quality evidence-based care is also very difficult to come by. And that's part of the reason why I do podcasts like this as well, is to help spread the word, because these things are common. And that's just part of taking good care of your patients. For example, hypertension is also common. Diabetes is also common. Most medical doctors, most physicians are very good at treating those conditions, but there's other things that there's a big hole. So I try to become as good at those things as possible. In addition, I'm a fan of mechanism of action. When you think about evidence-based medicine, there's a pyramid. And at the top of the pyramid, you have meta-analyses, systematic reviews. And for a lot of conditions, there is those things. But hormones and obesity inherently are more individualized. So it requires more attention to mechanisms of action and what different inputs there might be. And that is also particularly exciting to me.
And you know, there's cause and effect, one of the oldest rules in the game, right? And so when you look at this and you say, okay, so we have take hormone imbalances and of course obesity. If we look at that, and for me as well, like looking at cause and effect, that's great. Like we can certainly treat the symptomatology, we can treat, you know, optimization of hormones or whatever else. But wouldn't you often say, and what's your opinion on this, like lifestyle factors and the things that you do already teach, if we went back, let me just ask you this question, right? If we went back to living in alignment with nature, we would eat the way we are supposed to be eating, not without all the chemicals and the crap and the mental, physical, emotional stress. If we went back to doing that, what percentage do you think of these chronic conditions would just naturally go away without a allopathic or otherwise medical type approach?
Yeah, if we went back to the true primal ways, like a real liver king, I suppose, then a lot of these pathologies that are common would go away, but other pathologies would arise. For example, you'd have less autoimmunity, but more infectious disease. You would have less diabetes and metabolic syndrome, but more orthopedic injuries. So often there is a trade-off. Another thing to think about is throughout much of human history, life expectancy has actually been less. So modern medicine is obviously wonderful. Most people, including definitely both of us, have experienced that, and it can be life-saving as well. But paying attention to what humans have selected to do over many years is important. And we've selected to be relatively efficient and to crave high caloric density foods and also to conserve energy. So a lot of these lifestyle interventions center around finding a movement pastime to last a lifetime, like people had before transportation technology, and also finding a more whole food diet, which again, people had before processed food technology.
Beautiful. And I think that's just important to understand, you know, when refrigeration came in and we learned about how to actually, you know, apply medicine, we could obviously live longer. So life expectancy is longer. So I didn't mean go back to tribal days, but rather to apply the ways of natural living within the current system. Because I see so much of it is, you're talking about hormone optimization and other things. I am of the philosophy that when we do go back to a natural, holistic way of eating, drinking water, feet on the ground, doing that a lot of those chronic diseases, particularly the metabolic ones in nature that you did speak of, will fall back into homeostasis, I guess. And is that part of what you're sharing with your patients as well in terms of your approach and treatment-wise?
Yes. I like to say that lifestyle interventions are more powerful than any medication or supplement, and diet and exercise are kind of the two cornerstone pillars of the pillars of health. So I like to write on prescription pads, and I've been involved in exercise as medicine and food as medicine societies for quite some time. And I like just to write out a specific prescription to help an individual, because perhaps one individual needs to do more anaerobic training. One individual might need more aerobic training or zone 2. So it's just like any other prescription. Depending on the patient, it will be slightly different. It can't, books are great and podcasts are great. And individuals can glean a lot about tools that they can use in their own health by consuming, the books and podcasts and such. But at the end of the day, getting advice from an expert specifically based on their situation is particularly helpful.
Oh, dude. And this is why this is so needed. I helped a GP, a general practicing medical doctor in Australia. She was in practice for 17 years. I helped her transition from a more allopathic type model into a holistic type model. She literally closed up the existing business of 17 years and started the first holistic a rural medical center in the history of Australia. And one of the things that she was doing when she started, she had the 3.5-month waiting list when she first opened up the doors. And what I remember, she did the same thing on her prescription pad. She would literally write a prescription, and then the patient would assume that this would be some sort of a pharmaceutical or something rather. And it would literally say the detail as to what to do. She called it lifestyle medicine. She was giving a prescription of lifestyle medicine, which was, yoga 3 times a week. It's time to stop the Coca-Cola, drink more water. And they would look at her kind of funny, but then she was real. Like, this is the actual medicine. And then we will obviously have, interventions along the way where necessary. So I was just blown away by that, because that's the kind of prescription pad that I think is real medicine in many ways. So I want to ask you, how do you optimize hormones using behavioral tools?
So the behavioral tools or lifestyle interventions are going to prevent pathologies that can affect hormone optimization. For example, preventing sleep apnea, preventing metabolic syndrome, which are 2 of the most common interrupters. Also, seemingly small dietary changes and seemingly small changes when it comes to, for example, your sleep or even your stress can have profound impacts. There's kind of this, I don't know if misconception is the right word, but there is a type of misconception where people think that they can do something to boost their hormone. But really, it's more like trying to get into, and I'm not sure if Australia has these, like a fraternity or a sorority. When you're trying to get in, you can't just be best friends with one of those like lifestyle habits. You have to check all the boxes, otherwise you will get blackballed. So when you have a suboptimal hormone profile, it's more about finding what is holding you back and then addressing that through lifestyle intervention.
Oh, I love it. I've been saying the same thing we used to do the same in our clinics as well. You'd go to a medical doctor and they would do the standard pathology looking for pathology only kind of tests. So that, they'll do the bloods based on whatever the symptomatology was. And I remember I had a patient come to me and he was basically producing little to hardly any testosterone at all. He's been to GP to GP to GP, and they just did the same test, looked at the hormones, the free floating testosterone was low and whatever else. And then I said, great, well, can you give me the broad spectrum tests that were done to look at the other hormones and minerals that are necessary for creating testosterone? And obviously they hadn't been done. And so I referred him off to an integrative GP that I work with. They did, did an additional series of tests that I recommend for all patients. And he came back that his zinc profile was basically none. And as I explained to him, you do need zinc and other very important minerals to produce testosterone and other things. And over a period of time, he supplemented with 2 different types of zinc according to what was needed, hitting some intravenous, vitamin optimization and a couple other things, dietary stuff. And finally, after many, many years, his testosterone levels came back, love life was good, and so on and so forth. So what are your thoughts on that in terms of, it seems like somewhat that the standard system is only looking for pathology rather than really taking an integrative approach to see what's really going on in that patient's life so that you can have the data to make the necessary recommendations, which is, of course, going to be individualized. What are your thoughts on that?
Yeah, that's definitely true. I like to say you can always do more digging. So if you dig, whether it's into your into your whole genome or into your laboratory data or intracellular and serum micronutrients and vitamins, you will find things. Whether or not they're statistically significant or clinical significant is a discussion between the patient and their healthcare provider, of course, especially with genetic data and cancer markers. Mm-hmm. But if someone does not feel normal, or if they feel like they have an undiagnosed condition, it's like a difficult test question. You don't just ask yourself for sure, and you don't even just ask who you think is the smartest person in the class. You ask everybody you can, and you ask people from outside your class as well. Perhaps you ask people in YouTube comments. I don't know how helpful that is, but comment on this video if you have comments on your undiagnosed condition. But I'm always a fan of digging more. The other part of that is, yes, I'm a fan of health optimization. I consider my clinics health optimization clinics. But the first part of health optimization is preventive medicine. Just like the first part of building your supercar, race car is preventive maintenance.
Oh, I love this. Being proactive rather than reactive. And this is the case, right? I often look at symptomatology. We look at heart disease, cancer, many other things. I mean, they can be around, diabetes as well, for a very, very, very long time before there is symptomatology involved. So the question that I used to pose when I was, teaching this to the physicians that we used to recruit and work with, I was asking the question, how do you know if you're healthy? Right? And so when you look at it, you can say, I'm healthy because I feel great, but you can have cancer and still feel nothing. Blood cancer, for example, you can have, 80% blockage, 70% blockage of, coronary arteries and still feel no pain. So how do you know if you're healthy? I mean, one of the things that you're talking about so beautifully is you need to be able to do those tests and dig deeper to find out what really is happening on the inside so that you can indeed be proactive. I think this is phenomenal. I want to check in with you in regards to the genome. That's really of an interest because obviously these genes are part of the things that are turned on and off depending on lifestyle, emotions, and environmental factors, etc. What are some of the tests that you do to get more detail and data on genomes? Because that's something that I'm interested in doing more in my life as well because of the genetic coding. How do I know where I'm at with that? And what are the tests that you do and what kind of data would you get from something like that?
There's several different types of genetic tests that you can do. One common type of genetic test is called SNPs or SNP. That stands for single nucleotide polymorphism. Think of that as one letter of one word in one chapter of one book of the encyclopedia. And these are just the most commonly, probably clinically significant changes in the genome that are often normal, but frequently they determine things like pharmacologic response, how you tolerate or metabolize a medication or even a supplement. And then they can also tell you things like Alzheimer's risk, blood clot risk, but if there's no other reason to check it. So whenever you check a test, whether it's a genetic test or otherwise, you want to have a potential change in management. For example, if someone is on hormone replacement therapy and they would perceive to be at slightly increased risk of VTE, venous thromboembolism, or a blood clot, then they might be a better candidate to check like a factor V Leiden, which is one SNP. And I ordered that test on a patient today. I think it's like $30 wholesale. And it would potentially change management. Perhaps you would do something to slightly attenuate their clot risk or even adjust their dose of estrogen. But at the end of the day, genetic testing is just like any other test. You have your balance and your scale, and you have the benefits and the detriments. And it might be a benefit or a detriment, and that would weigh the scale slightly tilting up and down to where the benefits outweigh or do not outweigh the detriments. So all that being said about SNPs, you can also get full genome testing at the other end of the spectrum. This would test things other than just the single nucleotide polymorphism. Mm-hmm. And as we learn more, this can be more and more clinically significant. One important thing to keep in mind is most of the data, especially when it comes to like full genome sequencing for other mutations like missense or deletions or trinucleotide repeats, is correlation. And we know that there is a causation component, but we do not know how clinically significant it is. So if you asked an expert, for example, MD, PhD in clinical genomics, they would likely say it is unknown. So that's an important discussion to have with your healthcare provider.
That makes sense. Yeah, it's not literally to look at it black and white, but to understand the interaction between everything that's happening. Yeah, that's huge.
There are some health reasons to consider intermittent fasting. Active cancer or significant cancer predisposition is one of them. Just to lose body weight or just to lose body fat, in my opinion, is not. The literature is pretty significant, is pretty clear. It might slightly speed up, kind of like a very low calorie diet, the weight loss, but then at some period of time, everything evens out. And my main concern would be loss of lean metabolically active muscle tissue. Mm-hmm. So depending on what your predisposition is to lose lean body mass or to accrue lean body mass, you might be a better or worse candidate for intermittent fasting. On my prescription pad, where I circle different interventions for body composition optimization and nutrition, number of meals per day is just one of 6 different parameters that people should take in mind.
Love it. Love it. Okay, so for those watching and listening, this is really great. We're going to transition in about 5 minutes time, a little bit less, into an uncensored version on Dr. ETV, where we're going to go a little bit deeper into a couple of topics. But before we do, there's a couple other things. Firstly, before I share my final questions, would you tell our listeners and viewers where they can go to find out more information about the work that you do?
My main hub is on Instagram. It's Kyle Gillett, MD. If they type in Gillett Health with any spelling and their URL bar, that will be my website. On all other platforms, it's just Gillett Health.
Gillett. Thank you very much for clarifying the way we pronounce that. That's awesome. Thank you. And I have one question for you. I love this question. And again, I've already said it several times. I really want to thank you for the work that you're doing. I want to thank you for the time that you've spent being here with us today. And right now, it's such an inspiration for me to see that there are physicians out there that are really doing this kind of work, because as we know, it's one of the key factors to living incredible lives, is to really be proactive within our approach and to look at lifestyle and those primary interventions first. And it's really having a beautiful impact on our planet. So thank you for being one of the pillars in that beautiful expression of what I refer to as real medicine. I want to say really thank you for that, and we honor you for that. So here's my last question, buddy. I want you now to imagine that you're on the world stage. Okay, you're on the world stage. Millions of people, however many of you, have gathered there, and they're all there patiently waiting to hear your message. So take your time, whatever flows through, whatever feels good for you. Please do tell us, what is your message to the world right now?
My message would be related to health. That is what I feel that I'm an expert in. I would probably stay away from social or political commentary. But when it comes to your health, there are many things that you can and should do, but there's nothing that you have to do. So there's kind of like 3 types of people, and there's also 3 types of car owners, back to a motor vehicle analogy. So there's people who get their car and they take great care of it. They put on turbocharger and nitrous. They wax and wash it every single weekend, and they change out everything so that its performance is best. And they never drive it on a day that's raining. And they keep it in the garage, but they take great care of it. And then there's the type that just gets their oil changed and their tires rotated. And then there's a type that does nothing. They never do an oil change. They don't even rotate their tires. They never take it to a mechanic. People are like that with their health as well. And it is perfectly fine to try to optimize your health, just like the first group. And it's also perfectly fine if you just never want to see a doctor, as long as you know that there is other options. And then of course, there's people all the way in between. Some interventions that I think are very high yield of relatively recent technology: checking your apolipoprotein B. We know that's much more correlated with heart attack and stroke risk than LDL. If you are high risk of heart attack and stroke, and in general over the age of 45 or so, checking a CCTA is way better than a calcium score. It checks for uncalcified plaque as well. Even if you have a calcium score of 0, you could be at risk. And then past that, even if your doctor says your glucose is normal, go ahead, check that fasting insulin and check that A1C. There's probably a 50% chance that it's high, and there's some degree of metabolic syndrome.
Boom, spoken like a pro. Love it. Thank you so much for that. Okay, guys, Dr. Gillett, go check out his website, check out his Instagram, reach out if you guys have any questions. And certainly in regards to these tests, I think it's really, really awesome to be able to get them done when and how relevant, because to see is to know, not to see is to guess. So thank you so much for your time once again. We're going to hop into the uncensored version. I can't wait to go even deeper on these topics. Thank you. God bless, and Merry Christmas also.
Thank you. Likewise.
Thanks, buddy.